Hello, my name is Ifeinwa Okeke, and here is the counter argument from the placebo group. IBS is one of the most common type of functional bowel disorder. Increasing attention has been paid to the causative role of food in IBS. Food ingestion precipitates or exacerbates symptoms such as abdominal pain and bloating in patients with IBS through different hypothesized mechanisms, including immune and mast cell activation, mechanoreceptor stimulation, and chemosensory activation. Wheat is regarded as one of the most relevant IBS triggers, although which component of wheat involved in this remains unknown. Gluten, other wheat protein, and FODMAP have been identified as possible factors for symptom generation and exacerbation. This uncertainty on the true culprit opens a scenario of semantic definition favored by the discordant result of double-blinded placebo-controlled trial, which have generated various terms ranges from non coeliac gluten sensitivity to the broader one of non-coeliac wheat or wheat protein sensitivity, or even FODMAP sensitivity. The role of FODMAP in eliciting the clinical picture of IBS goes further, since these short-chain carbohydrates are found in many other dietary components, including vegetables and fruits. IBS has been traditionally thought of as a brain-gut disorder, and a large number of patients with IBS believe that certain foods exacerbate their IBS symptom. There is, however, insufficient evidence that food allergy testing or exclusion diet are efficacious in IBS, and their routine use outside of clinical trial is not recommended. Approximately 60% of IBS patients believe that food exacerbates their symptoms, and research has suggested that allergy to certain foods can trigger IBS symptoms. A systematic review identified 8 studies that assessed a symptomatic response to exclusion diet in 500 IBS subjects. Studies reported a positive response in 12.5% to 65% of patients, but the absence of control group makes it unclear whether these rates simply reflect a placebo response. There is no correlation between food that patients identify as a cause of their IBS symptoms and the result of food allergy symptoms or food allergy testing. One randomized trial suggested that patients with IBS can identify food that causes symptoms, but subsequent studies have failed to substantiate this. The American College of Gastroenterology's Task Force on Irritable Bowel Syndrome state that management of IBS primarily consists of psychological support and recommendation of dietary measures, and that pharmacological treatment is adjunctive and should be focused on symptoms. Successful management of IBS relies on strong patient-provider relationship, reassuring the patient that IBS does not have a biological pathology tells us that the patient can have normal life expectancy. Although the condition is chronic, IBS can be managed by limiting symptoms and limiting exacerbation, just like treatment of asthma. Because of the psychological component associated with IBS, patients can be educated to identify the stressors that exacerbate IBS symptoms and develop avoidance technique to reduce exacerbation frequency. In 2009, the American College of Gastroenterologists recommended management of non-gastrointestinal symptoms and concurrent commodities to improve overall quality of life. However, the American College of Gastroenterologists did not find sufficient evidence that diet and food allergy testing could be excluded from the overall management of IBS. Thank you.